I'm Derek Ford. I'm a plastic surgeon practicing in Toronto. There are three different types of breast implants available in the Canadian market. Class number one is a saline-filled implant. It has a silicone shell and is filled with salt water. The second type of implant has the same shell. It is a round, smooth implant filled with a form-stable gel or silicone gel, which is a semi-solid, so if the implant breaks in half, it still is in one piece. And then lastly is a shaped implant, which is more of like a teardrop, and that implant is more often used for breast reconstruction. That also contains a form-stable gel, which is a semi-solid. Breast implant sizing is dependent on measurements taken during your consultation. It is most influenced by the base width of your breast and also the amount of projection that you are desiring from the breast augmentation surgery. We typically take pictures of your chest during your consultation and use those images to generate a three-dimensional image of your chest and your breasts and simulate what the operation outcome may look like with different sized implants. The three most common incisions for breast augmentation surgery are placing the incision in the fold of the breast, which is in our practice the most common incision because it is the most accurate and it's the least visible of all incisions. The second most common is around the areola, because the incision is 4 to 5 centimeters in length for a round gel implant. Sometimes if you have a small areola, it is not possible to use that incision. And then lastly, an incision in the armpit. That incision is best used for saline implants, which are usually deflated and placed through a smaller incision and then inflated with saline once they're placed underneath the breast. So patients that are thinner benefit from placing the implant underneath the muscle. You can see in this diagram there's a pectoralis major muscle which covers the top part of the implant and camouflages the edge of the implant from the surface. Patients that have more breast tissue or more subcutaneous fat can certainly have the implant placed on top of the muscle, which would be in this plane here, and because there will be enough soft tissue to camouflage the edges of the implant. So just in summary, patients that are thinner often benefit from placing the implant underneath the pectoralis major muscle. People that have more of their own breast tissue or subcutaneous soft tissue are better candidates for placing the implant on top of the muscle. The scar is typically 4 to 5 centimeters in length after breast augmentation surgery for gel implants or silicone implants. The scars are typically end up being fine white lines over a period of a year. Initially they're fine pink lines. All the stitches that we use are dissolvable and buried underneath the skin to maximize the quality of the scar. We typically suggest applying silicone creams after your surgery to improve the scar quality, and also taping the scar, which can further improve the appearance of the scar. It's usually recommended that you keep the scar away from UV light or the sun, as the UV light can darken the scar with time. And also we suggest not wearing an underwire bra in the first 6 weeks after surgery, as that can irritate the scar early on. Contemporary implants are quite strong. You can see with this implant, this is a smooth round silicone implant which is filled with a silicone gel that is form stable, meaning that it is semi-solid. When I squeeze on this implant firmly, it distorts but goes back to its normal shape, and you can see how durable it is. Breastfeeding is possible after breast augmentation surgery. It may be not possible if the nipple is numb after the operation. The chances of nipple numbness or the risk of nipple numbness after breast augmentation surgery is 5% or less. Mammograms miss approximately 10% of the breast in breasts that do not have a breast implant. When you do have a breast implant, approximately 30% of your breast is missed on a mammogram. There are some extra views that can be performed to visualize other aspects of the breast with a breast implant in place. However, if there is still an area in question, then an ultrasound or an MRI can be used in addition to a mammogram to visualize the entire breast.